Shoulder pain after a stroke is fairly common, affecting up to 84% of survivors. And it can happen for a variety of different reasons. But if you experience it, you know that it can be extremely difficult to deal with. So today we're going to go through 2 sets of 5 stretches and exercises to help decrease post-stroke shoulder pain. Let's get into it. We're going to start off with around a minute of warm-ups today. So we're going to go ahead and start with some gentle neck stretches today. So what I want you to do is gently lean your head over to one side, like you're trying to bring your ear down towards the opposite shoulder, or the same shoulder rather. And you're just going to hold there for a few seconds, relax, and go over to the other side. We want to stretch out our neck because our shoulder and our arm is all interconnected with a lot of different muscles, including some that run up our neck. So we're going to go ahead and get those stretched out before we start. We've headed back to the other side. And quickly before we get into our first exercise, I just want you to roll your head down. And then go ahead and bring it back like you're bringing your eyes up to the ceiling. All right, fantastic job. Let's get into our first stretch, which is going to be scapular retraction. First exercise, scapular retraction, which means that we're gonna be bringing our shoulders back, like you're trying to pinch a penny between them, or a pencil, whatever you can think of, and then you're relaxing and bringing your shoulders forward. I'm gonna turn sideways so you can see this as well. So you're pulling your shoulder blades back, and then relaxing and repeating. We're just holding for a few seconds at the end of that movement. And again, we do this exercise because our shoulder and scapula, our shoulder blade, work together. To get our full range of motion, we need good scapular movement and good arm movement. All right, we've got a few more seconds here. Give me one more. Pull those shoulder blades together, pinch and squeeze, and go ahead and relax. Moving on to exercise number 2, which is going to be shoulder shrugs. So this is where we're bringing shoulders up to our ears and then pushing them down and relaxing. All right, let's keep going with this. Each of our exercises is going to be around 60 seconds. So you go at your own pace. There's no set repetitions here because everyone's kind of moving where they're at. So do what feels comfortable. As always, if you feel any pain, I want you to stop and back off. If you've watched any of my other videos, you know that is kind of the rule here. Do not push through pain. Very nice. Again, we are working on both scapular and shoulder movement with this exercise. So we want to focus on both and not just arm movement, although we are getting ready to get into that. Go ahead and bring those shoulders down. Give me one quick breath in through your nose, out through your mouth. Now we are moving into a shoulder flexion stretch. Now, my table is a little bit low for this. If you have one a little bit higher, that's what I would recommend, but that's okay. We're going with what we have today. If you have a small towel or washcloth, I'd recommend that. Affected arm is down. You may want to put your unaffected over the top. And what you're going to do is push that arm forward. Slowly and gently, you want to feel a nice stretch at the top of the shoulder. Holding here for a few seconds and bringing it back up. Fantastic job. Let's do that again. Push that arm forward. Hold here for a few seconds. Fantastic job. Now I want you to pull that arm back up. Excellent job. Let's move into our next exercise, which is actually supported shoulder flexion, and we're doing this active movement. So you can keep the towel here. I don't want you to use your unaffected hand if you don't have to. So what I want you to try to do is to gently try to push that affected arm forward and then pull it back. So we're not doing that hold, that stretch this time. We're gonna try to actively move a little bit more quickly. So here we're working on improving movement. We're working on improving strength. If you don't have this wide of a range of movement yet, that is a-okay. Everyone is starting where they are. So whatever movement you can get is fine. And if your hand will not flatten out and it wants to stay in a fist, or you can't get your elbow fully straightened out, that's a-okay. Just try to push from your shoulder and get the best movement you can. Okay, last exercise before we start our second set is going to be windshield wipers, also known as horizontal abduction and adduction. So either with your hand flat if you can get it, you're gonna bring your arm moving from side to side. Now, as you can see, it's probably better on a flat surface without this little ridge. I'm having to kind of hold on to the towel for that. But you want to swing your arm from side to side. And again, same rule applies here. If you cannot get your hand flat or your elbow perfectly straight, that's fine. But I do want you to focus on the movement from your shoulder and not from the elbow. Big movements all the way from the shoulder, because this is what we're trying to work on, that shoulder pain. And it can be easy to compensate with elbow movement, but we're going to try to avoid that. Let's bring that arm back over. Okay, go ahead and rest. Take one deep breath here, in through your nose. Breathe deeply out through your mouth. Good job. We're going back into our first exercise, which is scapular retraction, or bringing our shoulder blades back. So for this, remember, you're gonna try to pinch your shoulder blades back behind you, like there's a pencil between them, or a rolled up towel. Then you're gonna relax. Very nice, let's do that again. Because like I mentioned before, our shoulder doesn't live in isolation. We have muscles that cross our neck and our shoulder, our scapula, our shoulder blades. So we wanna make sure that we're focusing on all of those muscles as we stretch, as we move, as we strengthen. Bring those shoulder blades back again. Nice squeeze. I'm gonna turn around so you can see that again. Bringing those shoulder blades back, back, back. Pushing forward, you're doing a great job. Let's do one more. Squeeze at the top there, and then bring them back forward. Excellent job. Let's move on to our next one, which is shoulder shrugs. So go ahead and bring those shoulders up to your ear. Fantastic. Let's lower back down. And we're just gonna repeat this. Again, you're gonna go at your own pace, and you're not gonna push through any pain. I like this exercise set because regardless of where you may be at, if you don't have a ton of movement, most of these exercises are pretty doable. If you notice that maybe your affected shoulder kind of lags behind as you try to lift them up, that's okay. The act of doing this is helping to strengthen those muscles, and hopefully with increased strength, with better movement, we are going to decrease some of that pain that you might have in your shoulders. Okay, let's do one more by lowering here. Wonderful job. We're going to go into the shoulder flexion stretch again. So this is where, if you have a towel or a washcloth, it may come in handy. You're gonna put your unaffected hand over the top of your affected side, and you're gonna help to push forward, giving that affected shoulder, that arm, a nice stretch out. Let's hold here for just a few seconds. Let's go ahead and bring it back. Wonderful job. You know, shoulder pain after a stroke can be caused by a lot of different things. It can, of course, be caused by muscle weakness, which can sometimes result in shoulder subluxation, or that minor dislocation, which if you haven't heard about, I did make a video about that you can go check out. It can be caused by neuropathic pain, which is where the brain and the body aren't communicating via the nerves effectively, and so that can result in pain. Spasticity can also cause that post-stroke shoulder pain. And doing some of these movement and stretches can help at least with the muscle weakness issues, some of the spasticity issues, and actually can help start to retrain the brain if you're experiencing that neuropathic pain. Let's go ahead and move into the active supported shoulder flexion movement. So this is where you're actively going to push your arm forward as far as you can take it and then bring it back. Wonderful job. Let's do some more of these. And this time we're not stopping to hold that stretch. We're trying to do that movement forward and back, forward and back. No holds here. And I'll mention it again, but if you cannot get your elbow straightened out or as much shoulder movement as I'm getting, if you can't get your hand flattened out, that's okay. I just want you to do the best you can. If you find that your arm starts to kind of come in a little bit, that's fine too. Start where you are, and any movement is better than none at all right now. All right, let's take a moment here. We're moving into our last exercise, which is the windshield wiper. So this is where we're gonna take arm from side to side. Now, if you find that having your unaffected hand over the top helps, that's okay, but what I don't want you to forget to do is actively try to move your affected side. So even if your unaffected side is helping, that's okay, but I want you really actively focusing on moving the affected arm. You're doing great. Let's get in a few more of these, and then we're gonna be done. So hang with me. All right, I want you to give me one more, okay? One more. You're hanging in there, doing a great job. Let's bring it all the way back home. Wonderful. Relax. You should be so proud of yourself. I hope that with some of these movements and stretches repeated, you will start to feel a little bit of relief in that shoulder pain. But as always, I am gonna leave a link down below if you'd like to sign up for the email list, which gets you free stroke recovery tips and motivational emails, as well as a free copy of my ebook, The Stroke Recovery Pocket Guide. And if you find value in what we do and you're able, please consider donating to Post Stroke, either by giving us a super thanks in the YouTube bar below, by donating once via PayPal, or by becoming a Patreon member, where in exchange for a monthly donation, you can get access to cool perks like social media shoutouts, behind the scenes footage, questions and answers, as well as YouTube shoutouts, of which I have one today. A huge thank you again to Doug C. for continuing to contribute at our Empower level. We can't do what we do without you. Thank you all so much for watching. I'll see you next time.